Here are 3 reasons why going to the chiropractor and them using long lever manipulations or even traction is injuring your spine more than helping it. Number 1, the nucleus, which is the thing the vertebrae sits on top of, has fibers that protect it and keep it in the center. One set of fibers is meant to resist counterclockwise, one set of fibers is meant to resist clockwise rotation. If I take a long lever manipulation and jump on somebody and twist them up, and then have them flip over onto the other side and twist that side up, I've just done micro tears to those fibers. Imagine doing that 2, 10, 20, 100 times, and now that nucleus, that thing that we're trying to protect, the thing that bulges or herniates on people and causes a lot of nerve issues or sciatica, that starts to breach out of the center and starts to cause more neurological issues. Number 2, you have curves in your neck, mid-back, low back that go front and back. They're your shock absorbers, like the shocks in your car. If I put you on non-angulated traction, so traction that just pulls you apart, or I yank on your head, I'm trying to do accelerated traction that way, Y strap if you're watching Instagram, that starts to pull the curves out. It starts to flatten the spine, which takes away your ability to compensate with compression forces. And also, your body does not like space. So if you sprain a joint, let's just imagine your ankle, you've caused some amount of derangement. It's created space. The body does not like space. It'll seek to fill it. It'll put fluid in there. It'll be swelling. When I do non-angulated traction and I pull you apart for several minutes, the body reads that there's space. So it starts to fill that area with fluid. So what was already swollen is now going to have more swelling. It's going to slam shut, and I'm actually starting to pull apart the curves. That's why non-angulated traction potentially is more damaging than it is helpful. It's just transient comfort. And in my office, what I see is usually people have a lot of pelvis instability when that happens. They come in and they're a lot harder to get better. Number 3, the reason why you feel so good after you have your neck twisted and pulled on and your whole spine twisted around is because you get a rush of dopamine, oxytocin, serotonin, GABA. You get this flood of neurochemistry, and you get this numbing effect on your system. It's an overload to the brain. So in a lot of ways, you won't even know that these micro traumas are happening. So what is the fix? The goal would be to find someone that is doing specific short lever corrections, finding someone that knows how the bone is, where it's supposed to go, to what depth, and how it articulates with everything. And there are several other nuances and techniques, but for the most part, we want to be just on the one that needs help.